Hello everyone, my name is Belen Lucas and my topic is Hypopyon and Klebsiella sepsis. Hypopyon is the collection of the pus in the bottom of the anterior chamber of the eye. It can be clearly visualized as a fluid level and the sedimentation is governed by the gravity. The composition of the pus would be only white cells or leukocytes without any pathogens of bacterial, fungal, or even viral origin. The pathophysiology of hypopyon. The basis on its appearance is not due to the infectious organisms, but it is due to the toxins that are released into certain intestines. These toxins will make more and more white blood cells, which are the defense against any pathogen or chemical harm to the body, to pour out from the blood vessels in the region. The hypopyon begin pus pulsations in the anterior chamber indicates inflammatory blood process and that region, mainly the iris and the uvea.
Now move your eye just a little bit, and then straight. And blink.
The causes.
And straight.
Infections of the iris and the uvea can be caused by both systemic as well as local conditions. Some of them are corneal ulcers, tuberculosis, herpes simplex and herpes zoster, Lyme disease and toxoplasmosis, and multiple sclerosis and psoriatic arthritis. The treatment. The treatment of hypopyon is dependent on its cause. If it's caused by tuberculosis, to treat the pathogen due to the tuberculosis should be an ideal option. On the other hand, the hypopyon will go away on its own without any treatment. However, if the underlying condition is not treated, it can result in glaucoma, visual impairment, cataract formation, and even retinal detachment. The Klebsiella sepsis. Klebsiella infections refer to several different types of healthcare-associated infections that are all caused by the Klebsiella bacteria, including pneumonia, bloodstream infections, wound or surgical site infections, and meningitis. Healthy people usually do not get Klebsiella infections. However, people who are hospitalized and receiving treatment for other conditions may be susceptible to these infections. In healthcare settings, people who require long courses of antibiotics and/or devices such as ventilators or intravenous catheters are at the most risk for Klebsiella infections. These infections are often treated with antibiotics, although some Klebsiella bacteria may be resistant to certain types of antibiotics. The causes. In healthcare settings, Klebsiella bacteria can be spread through person-to-person contact or less commonly by contamination of the environment. It is not spread through the air. Patients in healthcare settings may be exposed to Klebsiella when they are on ventilators that are breathing machines or have intravenous catheters or wounds that can be caused by injury or surgery. Symptoms. The signs and symptoms of Klebsiella infections vary since Klebsiella bacteria can cause several different types of conditions. For example, community-acquired pneumonia is one common type of Klebsiella infections, which can lead to lung damage and even death in several cases. Early signs and symptoms of these conditions include high fevers, chills, flu-like symptoms, cough with yellow and or bloody mucus, shortness of breath, that is called dyspnea, and other common Klebsiella infections include bloodstream infections, wound or surgical site infections, and meningitis. The treatment. The treatment of Klebsiella infections can be complicated since some Klebsiella bacteria are resistant to certain types of antibiotics. Once a person is diagnosed with one of these infections, a healthcare provider will usually order specialized laboratory testings to determine which antibiotics may be used to treat the Klebsiella infections. If the healthcare provider prescribes an antibiotic, it is important to take the medication exactly as instructed and to continue taking the prescribed course, even if the symptoms are gone. If treatment stops too soon, some bacteria may survive and the person may become reinfected.
Una cosa es ver el fútbol y otra es vivir el fútbol. Una cosa es comer.
Klebsiella is a type of gram-negative bacteria that can cause different types of healthcare-associated infections, including pneumonia, bloodstream infections, wound or surgical site infections, and meningitis. Increasingly, Klebsiella bacteria have developed antimicrobial resistance. Klebsiella bacteria are normally found in the human intestines, where they do not cause disease. They are also found in human feces. In healthcare settings, Klebsiella infections commonly occur among sick patients who are receiving treatment for other conditions. Patients whose care requires devices like ventilators or intravenous catheters, and patients who are taking long courses of certain antibiotics are most at risk for Klebsiella infections. Healthy people usually do not get the infections. To get a Klebsiella infection, a person must be exposed to the bacteria. For example, Klebsiella must enter the respiratory tract to cause pneumonia, or the blood to cause a bloodstream infection. In healthcare settings, Klebsiella bacteria can be spread through person-to-person contact, or less commonly by contamination of the environment. The bacteria are not spread through the air. Patients in healthcare settings also may be exposed to Klebsiella through medical equipment during treatment or surgery. Unfortunately, these medical tools and conditions may allow the bacteria to enter the body and cause infections. These are just a few things to know about Klebsiella and healthcare environments. To learn more about environmental infectious diseases and pathogens, or indoor air quality testing services and prevention measures, please visit the website shown on the screen.